Hello, thank you for joining us for this special presentation on CBS News Colorado. I'm political specialist Shaun Boyd. Over the next hour, we are going to take an in-depth look at the growing threat of fentanyl in Colorado. You'll hear from people on the front lines of the crisis and learn what they think needs to be done to combat this. Let's start, though, with a look at why this powerful opioid is fast becoming a top killer.
Fentanyl, a drug made in Chinese labs, shipped to Mexican cartels and smuggled across the border, is killing Coloradans at an alarming rate.
I have worked as a substance abuse counselor in the Boulder County community for the last 25 years. And it's a risk that I've never seen before.
100 times more potent than morphine, fentanyl killed 540 Coloradans in 2020, double the number killed in 2019. And preliminary data shows fentanyl deaths up 48% in 2021.
The size of a grain of salt is enough to kill the average person.
It's cheap, readily available, and versatile, mixed with cocaine, heroin, and meth, sprayed on marijuana, and pressed into pills sold as oxycodone, Xanax, and Adderall. Investigators say fentanyl-laced cocaine killed 5 people in Commerce City last month.
It is killing people who unsuspectedly think they're taking a different kind of drug.
Tests show more than 40% of street drugs are now cut with fentanyl. By increasing their potency, dealers can stretch their product and boost profits.
They're made, on the black market, so there's no control of how much is in them.
The third wave of the opioid epidemic, fentanyl is easier to access than prescription painkillers and cheaper and more potent than heroin. A little goes a long way, making it a black market commodity during COVID as travel restrictions made bulkier drugs harder to smuggle. At the same time, drug use soared and treatment was harder to find, contributing to an opioid epidemic inside a COVID pandemic.
The overdoses aren't just people with opioid use disorder. A lot of those overdoses are college kids.
Mila Long, a substance use counselor who is in recovery herself, says fentanyl hijacks the brain and withdrawal is so severe the best treatment is another drug, like methadone or Suboxone.
Some people might consider it trading one addiction for another, but it's not. We know this is a disease. It causes a direct defect to the functioning of the brain, right? And so just like someone with diabetes uses insulin and they're dependent on that, or heart disease, they need heart medication. Same with addiction or opioid use disorder.
Long says at Denver Recovery Group, which takes Medicaid and walk-ins, they saw intakes triple last year. But most inpatient facilities have wait lists, and many insurers don't cover rehab. Medicaid only started paying a year ago. As overdoses skyrocket, the rescue medication Narcan is critical.
We have now given out over 600 doses of Narcan in the Boulder community.
Avani Dilger, founder of Natural Highs in Boulder, says education is also key.
For the longest time, we said, don't use alone, be with friends. But all of the precautions that we have taught people to, reduce the risk, they're not working with fentanyl. People are dying. They're testing their drugs and they're dying because the test strips don't even pick up if the fentanyl is on the other side of the tablet.
Many in law enforcement are calling for stiffer penalties. A 2019 state law made possession of 4 grams or less of most drugs, including fentanyl, a misdemeanor. Just 2 milligrams is lethal. The idea behind the law to treat, not jail, users.
The effort was to try to help people. The effect is that people are dying.
Denver Police Chief Paul Payson says the law has backfired. Public Defender Tristan Gorman says another war on drugs is not the answer.
Arrests, prosecution, and incarceration do not save lives.
A new bill would lower the threshold for felony charges in cases of importation, manufacturing, and distribution, and create new crimes for distribution resulting in death and possession of pill-making equipment. It would also offer some protection for Good Samaritans who report overdoses and stay with victims. The debate over how to respond to the growing threat of fentanyl comes as fatalities in Colorado increase at the second fastest rate in the country.
We've put together a panel that represents a diversity of thought from around the state. Joining us from Mesa County is investigator Tanya Brechlin with the Western Colorado Drug Task Force. She works undercover, so we'll hear but not see her tonight. From Pueblo, we have substance use treatment provider Dr. Shaun Gogarty. And from Boulder County District Attorney Michael Dougherty, who is also president of the Colorado District Attorney's Council. With us from the State Public Defender's Office is James Karbach. And finally, joining us here in Denver is Keith Hayes, the Director of Recovery at 5280 High School, and State Representative Leslie Herod, whose idea it was to have this panel discussion. So thank you, Representative Herod, and thank you all for being here tonight. You know, I want to start with what each of you are seeing in regards to fentanyl in your communities and what you think is driving the increased number of overdoses and the high rate of death in Colorado. And I want to start with Investigator Brechlin in Mesa County.
Good evening, Shaun. Thank you for having me. You know, in Mesa County, what we are seeing is a lot of people are actually seeking out the fentanyl to use fentanyl and to get the high of that opiate. We are seeing a lot of people that are enjoying, for a lack of a better word, of the high of the fentanyl, and so they're actually seeking it out and using it. I know a lot of some jurisdictions are seeing more of the accidental overdoses and accidental, you know, the two types of different drugs getting mixed together, but that's not what we're seeing here in Mesa County. We're seeing people that are actually opiate users and opiate addicts who are looking and seeking out the fentanyl.
I'm going to go to Dr. Gogarty now. What are you seeing in Pueblo in terms of this?
Thanks for having me, Shaun. I think in Pueblo, we have been seeing for quite a long time, well over a year, fentanyl mixed into pretty much everything, including meth and heroin. In just on the street testing from fentanyl test strips, we're seeing at least 60% of the meth and 60% of the heroin having fentanyl mixed in. So that's obviously a danger in and of itself because people don't know what they're getting, and nobody ever knows what the dose of anything is that they're getting. And then on top of that, a bit more recently, we've started seeing just the pills, just fake perk 30s that are actually fentanyl, or, you know, other fake pills, even some of the benzos that are, you know, not opiates, but are abused. They oftentimes are fentanyl, even though the people are buying them as Xanax or Ativan. And there has been some reports of fentanyl in black market marijuana as well.
Right, which is particularly scary. And Mr. Hayes, maybe you can, because you work with young people all the time, they're getting their drugs on the black market. Are you seeing an increase in overdoses as a result of fentanyl being mixed in with these street drugs?
I am. I had a freshman this year, 15-year-old young lady die as a result of a fentanyl overdose. And she was very well aware that she was smoking fentanyl. And I have several other students at my high school currently right now who are considered fentanyl addicts, and they have a physical dependency. We've had to send them off to treatment facilities to be able to detox and to be able to try to get them into recovery. Fentanyl is a serious, serious problem at our school and our communities. And the kids know what they are. And we serve kids here from the ages of 13 to 18, and they know. They call them blues. It's the fake perk 30 pills. They know exactly what they're getting. They have a physical dependency to them. They have lost the power of choice around using, and it's very scary for our community as a whole.
DA Dougherty, you can speak to this too. I know we've had deaths on CU's campus.
So we're seeing in Boulder County what's being seen all throughout the state of Colorado and the nation, which is a growing increase of fentanyl-related deaths that are so incredibly tragic. And I think it's partly because of what one of the other panelists just touched on, which is that fentanyl provides a cheaper and more potent high. But what's different about fentanyl than other drugs, of course, is that it's being laced into all different sorts of drugs without the users being aware that it's there. So whether it's Xanax, oxycodone, heroin, cocaine, meth, and even marijuana. We're seeing this show up. We had 27 deaths last year in Boulder County alone, hundreds throughout the state of Colorado, and that's true all across the nation. What I would really emphasize is for so many of those that have died, they're not actually overdoses, but poisonings, because they're using a substance that they don't realize is laced with fentanyl, and a small amount of fentanyl can tragically end a life. And we've seen far too many of those in Boulder County and throughout the entire state. So Shaun, thank you for bringing us together to talk about this tonight, because I think raising awareness is a really important step.
Yeah, I absolutely agree. I don't know if Representative Herod or Mr. Karbach have anything to add on this.
Well, Shaun, thank you for having me. I will just say, I think you've heard from other panelists that there's a mixture of both. There are people who use this without knowing, and then there are people who get addicted to it and are seeking it out. And so it's taking different forms. I think the other thing to note, though, is that how people are coming to use fentanyl, I think, is really consistent with how people have used other drugs over time. So I don't think fentanyl is unique in that way, in terms of a breadth of ways that people can come to arrive at it, whether it's legitimate pain pills that then they don't have access to, social interactions, family introduction, untreated mental illness. The causes for people using it are the same as they are for all the other substances, but some are introduced not knowing it, and some are seeking it out.
Yeah, I touched in my introduction to this on the fact that, I mean, it's almost like a perfect storm here, because we had COVID and the drug use is going up. We had the crackdown on prescription drug use. So you had people addicted to prescription medications looking for an alternative, and then heroin users who were looking for that better high and cheaper high, right?
Yeah, I think, first of all, Shaun, thanks so much for having us and bringing us all together. Thank you to this panel, who I know is doing so much work to try to save lives when it comes to fentanyl overdoses. Fentanyl is a public health pandemic in the state. Addiction is a public health pandemic in the state, and it quite frankly has been, but it's gotten worse. People are in crisis, a mental health crisis right now, and some, even our young people, are turning to drugs and medication to solve problems, or to make things just go away. And so we're seeing fentanyl use exploding across the state, but we're also seeing an increase in the use of all drugs. Additionally, we're seeing the crimes of desperation increase as well. And a lot of them are connected to this addiction. And so what we're seeing in Denver and what we're seeing throughout the state, and what I'm hoping to get from this panel are solutions from folks from multiple different perspectives as to what we can do to address this, because we need to save lives, and we also need to make sure that we stop the rising tide of fentanyl from coming into the state once and for all.
Thank you. While you all describe similar challenges in dealing with fentanyl, I suspect you have different ideas on how to address these challenges, especially when it comes to criminal penalties. As I mentioned earlier, a law passed in 2019 makes possession of most drugs, including fentanyl, a misdemeanor. Denver Police Chief Paul Payson says that law is contributing to the problem, but Mila Long, who is in recovery and works with people in recovery, says changing that law may also result in unintended consequences.
People that are dealing, they will have 3.9 grams of fentanyl. If we're talking about what personal use is of fentanyl, it's about 1/10 of a gram. And yet the individuals that we are seeing on a regular basis at Denver's Union Station are running around with about 3.9 grams. They know the law very well, and they are utilizing this loophole in order to continue to sell this deadly substance that is killing people in our community.
Because fentanyl is now many people's drug of choice, my worry about this bill is that we will be locking up, again, people who are just struggling with this disease. Right. And so I think there needs to be really clear guidelines of who is getting in trouble, or what the exact amount is that will get someone in trouble. Right. Because I have clients who are using 30 to 40 fentanyl pills a day. Okay.
So, Representative Herod, you were one of the sponsors of that law that had bipartisan support in 2019. Should the law be changed at this point to create felony charges for fentanyl possession, distribution, both? Your thoughts?
Well, unfortunately, I couldn't hear the entire package, but I will listen to that soon. What I would say is that our bill did have bipartisan support. Democrats and Republicans, former law enforcement officers, who all said clearly, we cannot incarcerate ourselves out of addiction. If you are an addict, you need treatment. And criminal penalties, right? So the notion that we decriminalized drugs in Colorado, it is just not true. And I want to make that really clear. It was really only on simple possession. And that bill we passed in 2019 said that people could still be incarcerated in jail for up to 18 months for simple possession. So we didn't even take away the jail time. However, what we are seeing is a call to change that bill, and I don't think it's appropriate. I think what we need to do is really focus on distribution. We need to focus on high-level offenders. We need to focus on people who are knowingly dealing fentanyl in our streets, and we need to look at those cases that also end in death. However, I do not believe, and you heard from this panel, that fentanyl is now in basically every single street drug. So I do not believe that just changing that law or getting rid of the misdemeanor possession offenses and making them felonies is going to be the answer. Because what it will do is lock up hundreds of thousands of Coloradans, hundreds of thousands, and I'm not exaggerating, hundreds of thousands of Coloradans, because we have before, on simple possession of drugs when really they need help and they need treatment. And so that's really what we're worried about is the unintended consequence of just opening up that Pandora's box. But what we are doing is looking at solutions that are a lot more nuanced, How much fentanyl do you actually have? Are you knowingly sharing or distributing? Are you a good Samaritan, that is just trying to save a friend that unknowingly ingested fentanyl and you're giving them that Narcan and taking them to the hospital? Should you be swept up in felony prosecution as well? And so these are the really tough questions that we're grappling with right now. Alongside of the fact that, again, it's a public health pandemic, so we have to put so much more money, so much more resources into treatment and get people there.
DA Dougherty, if this law only addresses possession, why aren't more dealers being charged?
Well, I would say a couple things, Shaun. First, we definitely need more treatment for those caught in the throes of addiction. There have been several steps taken over the last 10 years in the state of Colorado to reclassify how we treat possession, but where we need to make more progress is increase the amount of treatment that we have available in the community, because there are too many people struggling with addiction, and it's incredibly powerful and difficult for people to overcome. We also need stronger penalties for those distributing fentanyl and causing death. And I agree with Representative Herod that it's a public health crisis. And if you agree that that's the case, then certainly we should be having stiffer penalties for those that are profiting off the public health crisis. So when you think about the 5 people who died tragically in Commerce City, they believe they were taking cocaine based on the public statements from DA Mason, or the West Point cadets that were just down in Florida who thought they were taking another substance. We need to have stiffer penalties for the dealers and make sure that we can actually bring real sentences, real penalties to bear on the dealers who are profiting off this public health crisis. With regards to fentanyl, I do think that higher penalties, stiffer penalties around fentanyl distribution will make a difference. I think it'll have a deterrent effect when you talk about dealers as opposed to those who are addicted to drugs. We just recently here in Boulder County charged an individual with manslaughter for giving someone fentanyl-laced pills, the blue pills that Mr. Hayes referenced earlier, and told them that it was Xanax. And now they're alleged to be responsible for the death of a young woman. And the manslaughter charge is eligible for probation. And just generally speaking, I don't think it should be a probation eligible offense when someone's responsible for knowingly causing the death of another. And of course, prosecuting dealers has to be a high priority. And I know that for many jurisdictions, it is that, but it's also the different penalties that will allow us to ensure that these people don't go on to reoffend and further prey on individuals who are stuck in an addiction.
Would it help to have a specific law addressing distribution resulting in death and have a sentence attached to that?
Yes, so that could be done in a number of different ways, and it could be attached to the drug felonies that we currently have on the books, or it could be a separate offense. And I know those are very active discussions at the legislature. right now, but certainly distribution resulting in death is something that needs a stiffer sentence here in Colorado, and I think it would make a really significant difference.
Thanks. Mr.
Shaun, can I make a comment there?
Go ahead.
I was just going to note that there have been physicians that were involved with distribution, incorrect distribution of pills, and they have been charged with murder. And that's happened more than once across the country. Physicians charged with murder involved in distribution of things like opiates.
But not in Colorado.
Not that I'm aware of.
And I think that's what this bill is trying to address. Am I right, DA Dougherty?
If you're talking about a bill at the state legislature, I do think that those are things that will be being addressed. But I think I just want to call out DA Dougherty and I are on the same page. And so as we talk about, the possession bill in 2019 versus what we have to do now, it's not about possession, it's about distribution. And it seems to me like we're on the same page on that, which I greatly appreciate. And so the bill that we are looking at introducing in the State House will really look at that distribution and some of those increased penalties for knowingly distribution ending in death.
Mr. Karbach, has the 2019 law, it was designed, as Representative Harrod said, was designed to get people into treatment instead of jailing them. Has it worked in that sense?
Well, it's very difficult to tell you in some ways because of the pandemic disrupting the entire criminal justice system so radically. And it didn't just disrupt prosecutions, it disrupted treatment providers, keeping their doors open and moving to Zoom. And so it's not just the criminal justice system, but those treatment providers that were disrupted. But I will tell you, a focus on the 2019 law as changing and causing the higher overdoses, I don't think makes sense. When you look at the data over a longer period of time, overdose deaths in Colorado were climbing from 2010. And there was a period we dipped below the national level where it was climbing even faster across the nation in, say, 2015. And the Colorado Department of Health and Environment have looked at that. And so the notion that criminal penalties changed and that caused a bunch more youth, as opposed to rises in homelessness, economic problems in the community, COVID, kids out of school, and the host of other factors, I think is misplaced. It's easy to want to say, well, we changed some criminal penalties and that's causing it. But this is also a crisis across the nation. And we've seen that. Congress recently released an approach. This is a national problem. And so while Colorado rates vary in some ways, I really don't think the 2019 law, again, reducing this to misdemeanors that people can still go to jail to is responsible for this. Nor do I think going back would help, because when you give someone a felony conviction that's addicted to drugs, it cuts off opportunities to stabilize their life, get meaningful employment and other things. And the final thing I would say is, in going after dealers, there are already some robust laws on Colorado's books about what's called special offender. Someone that's older giving it to someone under 18, distributing a drug in Section 8 housing, doing it near a school, making a large amount of income and supporting yourself off drug sales. These things are already drug felony 1, the highest penalties we have. And so, and the other thing is, dealers vary greatly. Most drug addicts share drugs. Sometimes they'll buy a portion and sell some to their friends. And that act of dealing is different than where this is starting, with really, at least based on the congressional report and all the information I've seen, with precursors at this point being shipped to Mexico and large scale distribution going on there. And those penalties at the federal level will lock you up for life, and that hasn't deterred. So we know that criminal penalties don't stop drug use and addiction. And so that whole background, I think, has to inform this discussion. As Representative Harrod said, this is also a public health crisis that calls for a lot of public health solutions.
Investigator Brechlin, what are your thoughts on this based on your experience with drug offenders? Do stiffer penalties work?
I do believe stiffer penalties work. One of the struggles that we have in Mesa County is that we will focus a little bit of time on the user. And the only reason we do that is to try and get their information to build up the case, to try and get the dealer and trying to figure out who the dealer is. Our focus is not to put users in jail or into custody. Our focus is to work up the chain and take the head off the dragon, so to speak. The problem that we come across a lot is the typical users are so addicted to fentanyl and the opiates that they're very reluctant to give us information on who their dealer is, just simply because they don't want to be cut off from their dealer because they need that high so badly. So that is one of the problems that we face on a daily basis. We're also, like I said, we are not focusing on the users, but I do think stiffer penalties for the dealers and for the people that are causing the death absolutely is necessary.
And Dr. Gogarty, I don't know if you have any thoughts on this. You know, we were looking at framing a new bill really that, you know, making sure that the dealers and not the users are the ones that face the felony charges. And I think especially when we're talking about such a small amount of fentanyl that's lethal here.
Yeah, thank you. I appreciate what Ms. Brechlin just said, because if you put the question of it being a misdemeanor or a felony in front of a person who has substance use disorder, that's not a question. That's not going to change behavior. The definition of a substance use disorder is not making good choices as far as your health, safety, well-being, job, family, etc. So to expect a law to change that person's behavior is kind of a joke. So the other law that I have to bring up is when, and I watched this happen as I practiced emergency medicine, when we cracked down on the pills, which in my community were rampant. And, you know, that's why they got cracked down in part was what was going on in Pueblo. That's when the heroin epidemic started, literally, like overnight. In the emergency department, 17 years, I saw maybe 5 heroin-related cases. We cracked down on the pills, and I saw heroin-related cases every day from that point on. So I'm just saying from a user standpoint, the law is almost irrelevant, except, as has been noted, I think, by Mr. Karbach, if we make a felony of use, you've destroyed their opportunity of real recovery, because they're not going to get jobs, they're not going to get housing, and we end their future, which basically leads them back to drugs.
Mr. Hayes, do you agree?
I do agree. I'm a man in long-term recovery. I've been addicted to opiates. I've been addicted to cocaine. I've been addicted to alcohol. And I have multiple felonies as a result of my substance abuse. And I can't even get an apartment right now in my name because of the felonies that I have. So it does make it very challenging. I'm grateful that I was able to get into treatment. You know how I got into treatment? My probation officer, I was supposed to go do 3 years in prison, and she allowed me the opportunity to go to treatment. I went to the Salvation Army, right? Because I didn't have any kind of, my financial situation was not good. I was homeless. I was living on the streets. And she allowed me the opportunity to go to the Salvation Army, where I was able to find connection and find recovery. And the Salvation Army is a free program, right? And that allowed me an opportunity to be able to recreate my life. And the Salvation Army that I was in is not even open anymore. And what is happening is there is not a lot of treatment options for adults and for our youth. My student that overdosed, see, her social economic situation wasn't good enough. So she was waiting on a Medicaid bed. A Medicaid bed can take anywhere from 3 to 6 months. In between us waiting for a Medicaid bed, she had her 3rd overdose of fentanyl, and that was the one that killed her. So because she's not from an affluent family and doesn't have the resources to be able to purchase treatment, right? She wasn't able to get the help that she needs. And that's the issues that we struggle with as an organization, as a recovery high school, and trying to serve our students and get them the proper resources that they need. And recovery works. And I'm really here to speak about recovery. And people need to have the opportunity to find recovery. And recovery comes in a lot of different shapes and sizes, but it works. And if we want to help these addicts get well, we have to be able to provide the resources necessary for them to be able to find recovery and for them to be able to recreate their lives. I'm blessed that I get the opportunity to serve at a recovery high school where in high school is where my life started to spiral out of control. And I started to dibble and dabble with drugs. And now I get to come back here and serve these kids to show them a different way to live, to show them how to live one day at a time without drugs.
It's a good transition into our next subject, actually. District attorneys often use the threat of a felony charge to get a person into treatment. The question is, does forced treatment work? Boulder substance use treatment counselor Avani Dilger and Steamboat Springs police detective Sam Silva have seen different results.
My work as a substance abuse counselor for the last 25 years, I am working with a lot of people who are court ordered to do treatment. And that is often more successful because, addiction is really characterized by ambivalence, where one day I feel like I need treatment and I want treatment, and then the next day it's out the window. And so if somebody actually has a boundary around a treatment expectation, I have seen this work really well for people if then people have the opportunity to do good treatment, right? So I have consistently seen that as being very helpful.
The party that I talked to and who fortunately was very candid with me about her use admitted to taking 20 of those pills a day, every day, and knowing that any one of them could kill her. And she has, a daughter, a very young daughter. And I brought up the fact that there's a good chance that that daughter is not going to have a mom if she stays on that path. And she understood that and just didn't have any foresight to get help or to try to stop. What I've seen personally is that's something that treatments don't work until the person's ready, and forced generally doesn't work in my experience with dealing with people.
So Dr. Gogarty, we have a red flag law that allows police to seize the guns of people that are deemed to be a threat to themselves or others. Do we need a red flag law, do you think, for those who are addicted to fentanyl to get them into treatment?
So let's be clear first on two things. We need to define treatment, because I'm afraid in the majority of people's minds, treatment means getting them into a 30-day rehab. And as Mr. Hayes just pointed out, that's a very difficult task. There aren't enough beds and there is not enough money. And on top of that, the success rates of those are not as good as we would hope. So when I speak treatment, I'm talking about medical treatment, and that is available and it's readily available. And in most places you can get it same day, if, even walk-in, and I'm talking about medication-assisted treatment. So we need to be really clear on that as we discuss treatment. The other thing I think we need to be clear on is forced treatment is not a binary issue. It's not an either or, right? So for example, when someone gets locked up in jail for whatever reason, and they're abusing fentanyl or any opioid, you just forced them into treatment because you just put them into detox, right? They're going to go into withdrawals unless you provide them with some sort of medication. So the other place that happens is when you give a person Narcan. You've essentially made them withdraw. And those two examples are great examples, in my opinion, of where you can offer treatment. And states like West Virginia have shown that if you step in after an overdose, you have about a 25% chance right then of people.
Yep. You froze up there, Dr. Gogarty.
Going yesful. So were they forced into treatment? Them Narcan? Not really. And the same thing applies when talking about people coming out of jail. They should be offered treatment. They've already gone through the withdrawal, the detox. So give them an opportunity to change their life. That's not forced. Some may call it forced, but I'm just saying it's not a binary question.
Representative Herod, we weigh in on this because I have talked to Denver residents who would like to see people who are living in the alleys and on the sidewalks picked up and put in treatment, forced into treatment. They say that's the only way they're going to go in there.
Yeah, well, listen, sometimes forced treatment works and sometimes it doesn't. I think it depends on who's forcing it as well. But I have to agree that we do not provide enough treatment in Colorado. We know that. This is why I ran the ballot measure Caring for Denver a few years back, to provide more mental health and substance misuse funding right here in Denver. Because as a state legislature, I saw how bad of a job, quite frankly, we were doing. And because of Tabor and other reasons, we weren't able to put funding into these areas that we know decrease prison population, decrease the reliance on the foster care system, increase outcomes, increase productivity in the workplace, so many things. But we weren't offering services to the people of Colorado and quite frankly, the people of Denver. So I ran a ballot measure and that passed with 70% of the vote because Denverites said, we want to get people access to treatment. We want to get people alternative services. We founded STAR, Support Team Assisted Response, where now when you call 911 in Denver, you get a mental health professional and an EMT. But Caring for Denver is only about a year and a half, 2 years into funding. Our goal is to create an infrastructure of support and wellness like we've never seen before across this country. Other places may have it, but we don't. How can we get real services to people who need them? That could be at 5280 High School. That could be medically assisted treatment, be it in jail or in the community. We know that the jail is not a therapeutic environment. And so best case is elsewhere. But the one primary goal I have is so that we don't have people who have to get a felony offense before they get access to treatment, especially if they're low income. DA Dougherty, you might appreciate this story, but when I was a young buck at CU Boulder, go Buffs, if you could imagine, I had an underage drinking. I had my first drink at CU Boulder, and if you could imagine, got pretty caught up in that. But because I was a CU Boulder student, which we are considered to be more prestigious or more wealthy, more privileged, I went to a alcohol treatment, which was a class that was one day on a Saturday where we basically all talked about what we were going to do the next weekend. That was not real treatment. And I don't think the goal was actually real treatment there. It was like the tension, But for those of my friends who are not CU, they actually got caught up in the system. And that just shows you if you're privileged, the outcomes you get versus if you're not privileged, the outcomes you get. That's something that we need to change. Additionally, we need to make sure that there's treatment because I think everyone here agrees. And I think the folks you talk to in Denver agree that if people had access to treatment and if they were able to go on a 30-day program, a medically assisted program, whatever that looks like for them, that we would be better off. But right now, I believe we're almost ignoring the problem and just expecting it to get better. So the state legislature, alongside of this bill, is actually investing over $400 million into mental health. Right now, we're working on those bills. This is something that is completely unprecedented, and it's coming with the help of the federal government.
And I know, Dr. Gogarty, you have some thoughts on this, but I want to first go to our criminal justice trio here. Starting with you, DA Dougherty, does the threat of a felony, the ability to use the felony to hang that over somebody and say, look, if you don't get into treatment, really, we're talking diversion here, you're gonna end up with a felony on your record. Does that work?
Well, I think whether it's the threat of jail under a misdemeanor or the threat of prison under a felony, we've seen mixed results, and that can't be the only solution. And I think Mr. Hayes, I really appreciate, Mr. Hayes, you sharing your story. And I think it highlights how there's a time where the criminal justice system can play a role and can have success with those that are struggling with addiction and pushing and providing treatment opportunities for them. And I think we can have a healthy debate on that. Where I think we all agree is that Colorado has failed those struggling with addiction for many, many years. We rank in the bottom 10 in the nation in substance abuse treatment being available in the community. Also, bottom 10 for mental health treatment being available in the community. And as long as we continue to fail to invest in our people, we're going to continue to see the tragic consequences of those failures. And I do want to differentiate when we talk about those struggling with addiction. So many of the tragic deaths we see from fentanyl are actually poisonings. So these aren't individuals who would necessarily benefit from treatment or need to be forced into treatment. They're people who are being poisoned. They take one blue pill because they think they're going to have a nice time and relax with their friend or loved one, and they never wake up again. Those are the cases we're seeing over and over and over again right now. And I think when we talk about possession, the one thing we would also want to focus on is possession with intent. So that means for your viewers, of course, having enough of the substance that they demonstrate the intent to distribute that drug. And where fentanyl is different than a lot of other drugs is such small amounts of fentanyl can have a deadly and tragic impact on lives. And we've seen that far too many times. So under the law, and fentanyl has just become more potent in the last couple of years and more prevalent in the last couple of years, the same weight measure of 4 grams that we use for other drugs cannot apply to fentanyl because 4 grams of fentanyl can kill over 1,000 people. So that's why I agree with Representative Herod. Let's look forward to solutions and let's figure out how to improve the law to make sure that not only are we providing treatment, and I think those are really positive steps that we're currently taking right now through the state legislature and through Governor Polis's public safety package, but also how can we hold those who distribute fentanyl more responsible for the impact they're having on our communities and on our families.
So you would not support a bill that brought felony charges for possession? We're talking about distribution only for the felony charges, right?
I strongly believe we need more treatment for those who are addicted and stiffer penalties for those who distribute or possess with the intent to distribute and for those that cause death. So to answer your question, no. I don't think the answer here is to jail addicts and to reincarcerate addicts. So I think this argument in some ways, when I look at the news, is being portrayed as the threat of incarceration for drug addicts and those that say it's the only answer. And I actually think it's much more complex. And that's what you're seeing in the panel discussion here tonight, that I don't think jailing addicts is the answer out of this problem. And if it were, quite frankly, then we wouldn't be seeing the same issue all around the nation. So when people talk about the 2019 law, for example, they're choosing to ignore the fact that fentanyl is a real crisis for the entire country.
It's true. Investigator Brechlin, what are your thoughts on this?
You know, I completely agree with the district attorney. I feel that I don't think it helps to put users in jail. I don't feel like it helps to give them, there again, I think we need to utilize the drug users to get to the bigger fish, to get to the dealers and those people that are causing that. I feel that, you know, here in Mesa County, we have, I have to say, we have not had a lot of problems with mixing the drug. Have we had some? Yes. Some people that have used some stuff that thought, you know, maybe marijuana or cocaine that it has been mixed with fentanyl. Primarily here, what we are seeing so far is that they are actually using the blue pills in an illicit manner. You know, they're not taking the blue pills orally, and who knows what is contained in those blue pills. A lot of time, you know, they will smoke them, they will inject them, they will snort them, and 1/2 of the pill or 1/4 of that pill, they get high on and everything is fine. The next time they do it on the other half of that pill, there's possibly maybe a hot spot of a little bit more fentanyl in that one area and they don't know it. And so then they overdose accidentally on that. I've heard recently actually that 2 out of 5 of the blue pills contain a lethal dose of fentanyl. Well, that shows throughout the United States. And I mean, that's through, I found that out through a DEA meeting, Drug Enforcement Administration. So, I mean, that shows that is through nationwide what a big problem it is and the lethal dosage is of that. Just to kind of give you an example too, you know, we're not looking for the dealers, but just to show you an increase, in 2021, the Western Colorado Drug Task Force seized around 15,000 blue pills. In 2022, up until today, the Western Colorado Drug Task Force has seized about 8,000 pills. So we're way ahead of schedule and since last year. And that just shows how much it is progressing continuously.
And the need for awareness, certainly. Mr. Karbach, you're a public defender. I can't imagine that you're going to support a bill that would create new felony charges, but we are talking about, and I'm talking about distribution here, which this bill would address. Would the public defender's office support something like that when we are talking about a killer like fentanyl?
Well, look, as a resident of Colorado, I want safe communities as well. But what I will tell you is, when we talk about, first of all, felonies for users and threatening them with a felony for forced treatment, let me just say, if we build treatment beds, we increase treatment. If we increase penalties, we increase incarceration. Incarceration is a very indirect way to treatment. And when you jail addicted people for a period of time and then let them out, if they have a forced detox without the kind of medical treatment that Dr. Gogarty talks about, and I'm not a doctor, but I think he can confirm, they are at grave risk at their next use for overdose because their tolerance lowers. And the same with people in treatment. So when we're talking about this, I think we need to route the users to people like Dr. Gogarty, and you need to route them with people that can apply the medical treatment with a medical model, and Mr. Hayes, who can talk them through it, and not me talking to them about penalties or jail, or Mr. Dougherty in a courtroom, or even Officer Investigator Brechlin, who is trying to talk to them about where they got the drugs. It's much safer for them to talk about low-level users they know and turn Officer Brechlin onto them than the real people that would work up the chain. And that model has failed. Even a charge, when we talk about a charge, a felony level arrest, even if you end up with the misdemeanor disposition, that felony level arrest is what people will use to keep you from housing and jobs sometime. So this is not a threat that gets you into treatment. It is a criminal penalty that disrupts your life. On the broader dealer, I think we can look at the dealer penalties. And as I said, they're pretty robust on the special offender when you support yourself or you're a high level dealer. The real controversy comes in with how we define dealer, because friends give each other the drug. These drugs are passing through international borders in a lot of hands. And so low level dealers tend to be users and addicts who are sharing. Users, they form a social network just like any other social network that might be a pro-social. And so it is often the lowest level distributors who are not making their living or are just barely supporting their habit and struggling with the same mental illness that users lead you to. And if you start to capture that network and incarcerate them, you are just incarcerating the same population of users based on whether they were with other people or whether they got caught with their 40 pills that they just bought that are so cheap, or whether they'd already used 20 of them. So it's not that dealers should not face increased penalties and we shouldn't have that conversation. It's how do we really capture high-level dealers, those that, one, know it's fentanyl, because low-level dealers don't have any more knowledge than low-level users about this. How do we capture high-level dealers who are really making a profit living off this, shipping things in the community? And the problem is when we just use the term dealer, we lump everyone in from the people who are literally manufacturing this and shipping it in mass across international borders to an addict who shares it, or a college kid that buys some pills and then sells everybody in the room 10. And so the real key is more nuanced. And I really appreciate what Mr. Dougherty said and what Rep. Herod said, but that's where this gets so complicated, is who wears the dealer label and at what level do they wear the dealer label, because that really varies and is nuanced.
Yeah, Mr. Hayes, maybe you can speak to this. How many young people at 5280 high school would be caught up in this? If, depending on where we set this threshold, right? Where should it be set to balance that out?
Yeah, I mean, I haven't come across any fentanyl dealers here at our school, but I have had kids who have been addicted to fentanyl and they've lost the power of choice, right? They want to stop, but they don't know how to stop. Some don't have the resources to be able to stop, and then that's our job here to help get them connected to those resources to get them the proper help that they need. But it's about understanding the disease of addiction, and the addiction will take you to a place that no matter how bad you want to stop, for your family, for yourself, for those that you love, you can't, because you have a physical dependency. It centers in our mind. And when you want that or you need that next one, it's understanding how the disease of addiction works. And a kid who's 14 years old, addicted to fentanyl, right, whose brains haven't even properly developed yet, that's a hard ask. That's a very hard ask. And, you know, it's scary. It's really scary. And not to include that a kid can get cocaine, think they're getting powder cocaine, and it's laced with fentanyl, and that can kill you, or meth, or heroin, or any of these other drugs. So it's very frightening. And I'm worried the direction that this is going. And if a kid is dealing fentanyl, then yes, there needs to be consequences. If you are a fentanyl dealer and you are a teenager, then that needs to be addressed and dealt with, because you dealing fentanyl can kill somebody. And that's a real thing. And we literally have conversations here at school once every couple of days around the drug fentanyl and what it can do to you. And also having our kids understand that fentanyl can be in other drugs. You guys heard it earlier. We found in fentanyl laced in marijuana. So you don't know what you're getting in some of the most recreational drugs. So it's definitely about bringing awareness to the community and to our youth about what's out there, and then also getting them to the proper resources that they need to be able to get them the services that they need.
I want to get to prevention, but real quick, I want Dr. Gogarty to weigh in here. I don't know if you want to share a bit of your personal story and talk about what worked in your case with your son, and you know, whether stiffer penalties are needed. Are these users, are they dealers too? Where do we set this line? And I think too, you wanted to talk too about in terms of money being put into treatment.
Yes, thank you. I'm glad I don't sit in a courtroom, because these arguments from the district attorney and the public defender, they're great and actually spot on. I totally agree with what's been said about the nuance of it. On the street, in reality, and I had a son who used IV heroin for about 4 years, 10 years before that of pills. And of course I do addiction medicine now, so I'm pretty familiar with what's going on. And the term you steal or deal is legit. Like, that's what happens. So when Mr. Karbach talks about people selling some of their product, he's spot on. There's no way that you can live a life addicted to an opioid and not eventually be doing one or the other to some degree, or both, in order to sustain your addiction, sadly. I do also appreciate Mr. Hayes calling this a disease, because it makes me very nervous when we call it a behavior health problem or a mental health problem. When we call it a behavior health problem, it implies that we just have to change their behavior. And if we apply that thinking to something like diabetes type 2, that means that doctors would not give you medicine for your diabetes type 2 when you first were discovered. They would send you to a behavioral health coach or somebody that taught you how to eat properly or lose weight. And in the meantime, your sugar's going up, your kidneys are dying, your eyesight's going. Similarly, I think it's inappropriate for us to talk about this as a behavior problem when people are dying every day, as has sadly been pointed out already, and all of us are too much aware of. We should be addressing this as the disease it is. And when we have a disease, we start with medicine. And that's where treatment should be pointed first and foremost. And the other aspect of that is, if you've ever been with someone who's either going through withdrawals or using back and forth, they're not talking to you about their behavior. You could talk all day about their choices. And as Mr. Hayes accurately pointed out, they have no choice in their behavior. So to talk to them about, hey, make a better choice, it's not going to happen. If you get them on medicines and we redirect and calm their thinking, if you will, then we can address their behavioral health problems. So I hope going forward that money
Froze up there for a moment. We'll come back to you, Dr.
Behavioral health or death, or even
You froze
secondary
up for a minute there.
Yeah.
So
Sorry.
Go ahead. What were
Sorry.
you saying about money? You're hoping money?
I hope that money goes first to getting people into medical care, And that is what actually helps people get off of it, because what they're most afraid of in terms of treatment is withdrawal. And if you can help them through withdrawal with medicines, they're actually amenable to that concept. So I just hate to see us put money into behavioral health primarily. What we need to do is both, but it needs to actually start with medicine, and then we can talk to them and change behaviors.
So we've talked about criminal, go ahead. I'm sorry.
I was just going to say, with my own son, I went through all of the different approaches, and ultimately and gratefully, he has done well on Suboxone. Is employed, married, taking care of a family.
It's a good success story. We've talked about criminal penalties. We've talked about treatment. We got to talk about prevention too. I wonder, Representative Herod, would a statewide public awareness campaign help? What would that look like?
Yeah, absolutely. I think it would help. And I want to close the loop a little bit on this behavioral health and mental health conversation as well, because, recovery, mental health, addiction, it's not a straight line. It's not a straight line. It's a cyclical process. And so when we talk about funding for mental health, we're also talking about working with people before they get into crisis and while they're in crisis, so that they're not turning to drugs. I think that's really important as well. And I know 5280 High School does a lot of conversation around coping mechanisms, around depression, because we know that those are triggers for then substance misuse. And so we have to think about it as prevention as well. When it comes to a public health campaign, listen, I'm not a dare kid, I think, as I mentioned my story 20 years ago. But what I will say is that there is public awareness that needs to happen, because people don't know. Now maybe it's different in Mesa County, but a lot of folks don't know that they're using fentanyl. They might know they're using something, right? Especially the folks that I know around Denver, the club kids and all of them, who have come to me as their legislator because they lost a friend to a fentanyl overdose when no one knew they had fentanyl, but I don't know how much they cared, because they didn't know how dangerous it was, and we keep hearing time and time and time again of people who actually were, had access to Narcan. They give someone some Narcan on an overdose. They think give them one dose and it's not working. Well, on fentanyl, you need multiple doses if it's a suspected fentanyl overdose to bring someone back, but you can. But people don't know that. And so public awareness, not abstinence only, not shaming anyone, but really helping folks to understand a lot of the things that were discussed, around the realities around fentanyl, where it is in marijuana, in basically every street drug, how one side of the pill can be more potent than another, but also providing testing strips in places where we know there may be a lot of casual users as well. I think that's extremely, extremely, extremely important to save lives. And so what I think is important with this conversation and what we've heard today is that it's not just a criminal justice approach. It's not just a criminal penalty approach, although there is components of that, absolutely. But it is a public health approach. And now it's also, we have to think about harm reduction and then that treatment once we get someone there too. So how are we preventing that death is really important as well. I think public awareness helps. I think testing strips help. I think there's more things that we can do that I would look to this panel to think about and help us work through to ensure that folks don't get to the place where they may be taking fentanyl and then unfortunately taking a lethal dose of it.
Investigator Brechlin, maybe you can comment on this in terms of harm reduction strategies. I worry about those test strips. Do they provide a false sense of security in some cases?
I do believe they probably do. I was doing some research, and we actually have a place here in Grand Junction called Colorado Health Network. And it's basically a syringe exchange, but they do the Narcan and the test strips and the needle exchange, and it's all for free. So that's a really good benefit for the users if they use them properly. I think that sometimes those test strips do give a false hope or a false insecurity. You know what I mean? It's not always going to be as accurate as it may seem. And I don't know the scientific side of that at all. Please don't get me wrong, but I do think it does cause some issues, or it could.
Dougherty, do you think the community is really aware of this threat? And in talking with people, I know you're real involved in your community.
It's a top priority for our office. So we are working really closely with law enforcement and the drug task force here in Boulder County to raise awareness. And I think shows like this one, Shaun, and I'm really grateful to you and my fellow panelists, help raise awareness. And that's absolutely critical because, as Representative Herod highlighted, a lot of people who are taking fentanyl and some who are dying from fentanyl have no idea they're using it. That's the group to which we really need to raise awareness. It's not a just say no campaign, but it's letting folks know that the blue pill you think is Xanax, if you're not getting it from a pharmacy, it's likely laced with other substances, including fentanyl, and you may die. When I think about it, when you and I were kids, and if you were hanging out with Representative Herod at CU, someone may have offered you a drink and said, try this drink. There was never a danger that you were going to drop dead from the sip. Fentanyl, the sip, so to speak, is killing people. And too many young people are dying. The one thing I want to hit on that we haven't talked about tonight, that I'm hoping we'll see from our legislature, is more resources for law enforcement. These investigations into the deaths are incredibly resource intensive because often the deals are being made through social media apps and over phones and computers. So law enforcement needs to have the tools and the resources to conduct these investigations so that we can hold the dealers responsible. I mentioned at the start of tonight's show that we had 27 people die, drug-related deaths in Boulder County last year. In the city of Longmont alone, just Longmont, we had 34 Narcan saves where the Longmont Police Department brought 34 people back.
Wow.
So that number of deaths easily could have been double. And when you think about the whole county and the whole jurisdiction, far more than that. We're dealing with a true epidemic and a real crisis here in Colorado and across the nation. And law enforcement resources have to be a part of the discussion so we can hold dealers responsible for these poisonings and these deaths.
Everybody should be carrying Narcan. You know, the goal of this community conversation is to come up with an action plan, a plan to save lives. I want each of you to tell me what you think would most help. Mr. Hayes, we'll start with you.
I think continuing to have these conversations. It sounds like the state of Colorado is working on bringing funds in to be able to put more resources out there for people to find treatment, people to get involved in MAT, for all these different things that we know that can help people find recovery. And the thing is, we want to give people some hope today, right? There's people out there who are depressed, who are struggling, and we want them to feel some hope, that help is on the way, that we can recover, that you can get sober and stay sober and clean and live a life that you never thought was possible. And I'm just grateful for this panel and grateful that we're having these conversations. They're not easy conversations, they're difficult conversations, but we have a lot of people on this panel who are right on the ground and are trying to do their best to bring awareness to what's going on out here. And I just think we need to continue to have these conversations. We got to keep showing up for the people in our community, and we keep taking it one day at a time. And I think we'll get through this. I mean, I think this is the worst drug crisis that our country's ever seen. But at least we have people who are willing to show up. It's going to take all of us, the whole community, whether you're in recovery, out of recovery, whatever your responsibility is as a human, as a citizen of Colorado. It's going to take all of us if we're going to overcome this and see real change.
Dr. Gogarty, I know you see hope here too, but what do you hope comes out of this panel discussion?
I will focus on treatment as what I think we should do. And specifically, that would be if money is made available for any type of treatment, it should always include both types of treatment, meaning medical and behavioral. So I hate to see money go to one or the other. It should always be required to go to both. And the other place I think that we can really make a difference going forward is jails and prisons, because the estimates of people, and I'm sure others here can speak more accurately than me, but the estimates I've seen is that people
We'll come back to you in just a moment. I think he froze up there.
In jail and substance use disorder, they should be treated and on their way out connected immediately to connected immediately to services.
or the
I do
war?
have one comment on prevention, if you'll give me 1 second.
Sure.
One
Sure.
minute. We actually have good data to suggest who will become addicted. And that is based on great studies done in California on ACEs. And those are adverse childhood events. And I have yet to see anybody focus on those as a place to help the most at-risk people avoid their future, literally. But with a certain ACE score, you can predict a 400% increase in COPD, for example. In other words, addiction to nicotine, and so forth. But that's just a direction I think we should be looking for, helping prevent this in the future.
Sure, Mr. Karbach sees a lot of similarities in your clients, the people that you represent. What do you think needs to happen?
I think we need to put money into treatment, and the exact kind of treatment Dr. Gogarty talked about. Medical treatment, medical providers and treatment teams treating people, and we need to make sure that that access to treatment continues, as people might relapse because of the dangers that they face when they do it. So we need long-term support for those treatment models. We also should engage in harm reduction, which means using the counselors, the street level counselors, to address these problems, including distributing test strips, naloxone, Narcan, making those things available because we know they're saving lives. This would be a lot worse without those resources. Other states that have seen reductions have put their money and their efforts there. New Jersey, New Hampshire, Delaware, some of the states that have seen the greatest reductions have put their money there. And I hope that in trying to talk about criminal penalties for dealers, we don't sweep up too many people or waste too many resources on that, because really at the penalty level, the people that they need to go after are really international criminals, shipping this in from foreign countries in bulk. And so there's a role for the federal government, and already life penalties there. So I really hope we can do the harm reduction and treatment and put a lot of effort into that. And I also want to say, we've got to try and address some of the root causes. And I think Dr. Gogarty talked about childhood traumas, but homelessness, economic despair, and a lack of resources, these type of things can push people towards substance abuse. So I really hope that we can take a look at root causes and try and eliminate that stuff. I think public awareness is great. And for the college kids that may not know what they're getting, or a recreational user of cocaine that thinks they have a safe supply, I think that's important. But once someone is addicted, the public awareness, as we've talked about tonight, is not going to solve the problem. They need more intervention, and it takes a lot. We also have to address the mental health crisis in this state, because we know that we are funding that almost the lowest in the nation. And that when someone has untreated mental illness, they're likely to fall into this. So I hope we pour more resources and effort into those.
Investigator Brechlin, I just wonder your thoughts on, there are federal penalties for these high-level dealers, but how available is the federal government in helping investigate, especially given the magnitude of this problem?
Yes, that's a definite issue in the magnitude of it, because it is entirely United States wide and coming over the borders. We all know that. We have great success with the Western Colorado Drug Task Force. We are actually co-located with DEA, the Drug Enforcement Administration, and we work with them hand in hand. We've had a case in the last couple years that we've actually got some successful prosecutions federally on dealers that cause death to users. And they're looking at pretty severe federal sentences. I do think the enforcement on the dealers is absolutely necessary. There again, I've said it several times, I don't think on the users, but I do absolutely think on the dealers. We're starting to, treat all these overdoses as a homicide investigation if there is a death. We're looking at it as a homicide and trying to find the evidence of it, phones, statements from witnesses or whatever. So we're looking at it as a little bit more serious than just an overdose death. And I don't mean to say it like that, but we are making it extremely serious, and we are looking at a homicide. And if we can prove that it was intentionally, or if we can figure out who's giving them the pills that causing the death, we are not above prosecuting it federally.
And DA Dougherty, I know you'd probably agree with that. I wonder about a law even calling it a poisoning, creating a crime that calls it a poisoning. And then I think also, you have talked about how time intensive these investigations are, and your hope for more resources for law enforcement if we ever hope to get at the dealers.
That's right, Shaun. We certainly need to raise awareness so people are more aware and cognizant of the fact that fentanyl is being laced into so many substances. And we need more treatment for those who are struggling in the throes of addiction. But for those who are poisoned by fentanyl or whose death is caused by overdose by a dealer, we need law enforcement to have more resources so they can investigate those cases. We've had a lot of success in our diversion programs by offering people drug treatment. And on the cases that come to our office, the investigations that have had a death involved, we treat them as homicide investigations, and they are tremendously resource intensive, which is why I think the resources for law enforcement is a key part of it, but also making sure that we have stiffer, stronger penalties for those who possess with intent, distribute resulting in death. I will share with you though, Shaun, I am so excited and hopeful because I'm coming off a week of speaking with CU students, high school students, and my kids' middle school class. And I will just tell you that the younger generation is better, smarter, and more vocal than I ever was at that age. So I'm filled with hope, but we have an obligation to make sure that we protect them and help them. So to the parents out there, checking our kids' social media apps, checking their computers, making sure that we're doing everything we can, even in our personal lives, to prevent is really important. And thank you for helping us raise awareness, because that's a key part of this as well.
It's interesting. The young people wouldn't even begin to understand the controversy around these harm reduction strategies. To them, it just makes absolute sense. You carry Narcan with you. You help somebody out. You use test strips, right? Representative Herod, I'm going to give you the last word here in terms of what the state legislature, what you would like to see get done, concrete changes that would really help reduce deaths.
Yeah, well, listen, one of my main jobs and the reason why I'm here is because my job is to listen, to think about and understand what's going on in the community from the community's perspectives, and introduce law and legislation to address those concerns. I think we have a lot more agreement here than folks would initially have assumed. And that is inspiring. That is extremely encouraging. I think everywhere from personal stories to how we think we need to address it to who the target is very aligned. And so the nuance then is getting that onto paper and making sure that the devil, in the details we can get correct too. But I think we're very close to being there. So what I'm going to do is continue to work with the Speaker of the House, Alec Garnett, alongside of my Republican colleagues in the House, Representative Lynch and Sandridge, to take this conversation and put it into law, put it into a bill to introduce into the body. And that would include stiffer penalties for dealers, especially dealing that ends in death. That would include more testing strips and medically assisted treatment, as we talked about here. Resources for schools who are working with young people, and ensuring that folks who are in possession or who are addicts actually have access to treatment, not just incarceration. And I do believe that we need more resources for those higher level investigations, especially the ones that are happening online. It is terrifying that I can turn on my Instagram, ask people as an elected official to go to Instagram, Facebook, or Twitter to find out what's going on in our community, to hear from their elected officials, and find out that someone's jumping into their DMs and selling them drugs. That's a problem. In fact, when we share this, someone might be preying on people who are looking for solutions and help and offering them drugs instead. That is unacceptable. We have to take a keen eye to this. And I do believe that we need to have resources for those types of investigations. And so what I can commit to you is that very soon we will be introducing a bill that includes money, because I'm on the Joint Budget Committee, to these resources that we just described. And I hope as we work through this crisis, we know that one bill won't solve everything, but communication, conversation, it will get us to a closer place. And I believe it will save lives. And so I just thank you for hosting this conversation. I thank all the panelists. I feel like if we just stayed in this room or got into a room together, we would have that bill ready. And so I look forward to continuing the conversation with you all, and understanding from the community what more I need to know as we tackle this issue.
I'm glad to hear that the bill is bipartisan too, so it's not used as political fodder, right? It's a very important point. Absolutely. Thank you all so much for joining me. I've learned a lot from doing this. And I have hope too, which is good. Right. Clearly, there is a lot of work to be done, and I hope this community conversation inspires both awareness and change. If you'd like to comment on what we've talked about this hour, go to our Facebook page, search CBS Denver. I'm Shaun Boyd. Thanks for watching.